Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to take a look at probably the most critical exercise that you can do in that first few days, in that first week after knee replacement surgery. Hey everyone, so today we're looking at what I think is probably the most critical, the most important exercise that you can do in the first few days and that first week after knee replacement surgery. Now, not to say that this exercise is not important for the remainder of your rehab and recovery, but especially in that first week, those first days after surgery, this is a really beneficial and really important exercise to perform. And then I'm going to share a couple ways that we can progress or do some exercises that are very similar to this exercise. So the exercise I'm talking about is quad sets. So quad sets are a very important exercise for a couple of different reasons. So one, it activates and starts to strengthen your quadricep muscles. Those are the big muscles on the front part of your thigh that work to straighten or extend the knee. These muscles are inhibited, they're weak, they're atrophied after your knee replacement surgery. And because of all these things, this weakness is very significant and can last for quite a long time after your surgery. And the quadricep muscles are a very big muscle and very important for both your function, your mobility, as well as providing stability around the knee joint. So very important to start to contract and activate and strengthen these muscles again after your surgery so you don't have that atrophy and that deficit for a very long time. Another very important reason to perform quadricep sets is for your knee extension or your knee straightening range of motion. There's actually a number of studies that look at knee replacement surgery and other knee surgeries, and they find that your ability to restore knee straightening or knee extension range of motion early on after surgery, so within the first few days, the first week or so, being able to get your knee to perfectly straight or 0 degrees extension is a very good predictor of what kind of outcome you're going to have from your surgery. So getting that knee extension, that knee straightening range of motion is really important and a really good sign of having a good outcome and a good recovery overall from knee replacement surgery. And it really just is going to be beneficial as you get that knee straightening and that knee extension. That's going to help with functional activities like walking. It's going to help you with going up and down stairs better. It's going to help with all sorts of different activities. So quadricep sets are a pretty straightforward, pretty easy exercise. I'll show you how I like to instruct my clients on how to do it. So I like to get a nice big towel roll, and this is going to go underneath your heel. If you have a bolster, a foam roller, a pillow that you can fold up, anything that's similar you can use, but basically you're going to be either laying down or in this long sitting position. Another option, if you don't have a surface or a couch or something like that, or you want something a little firmer, what you can do is if you sit in a chair and then you put a chair and flip it around so it's facing you, you can have your legs on the chair and you sitting in the other chair. So what I like to do is I take the towel roll or whatever the similar object is, and you're going to put it right underneath your heel. Right underneath the heel of the surgical leg, the leg we're working on. And you want to have it be big enough so that there's a little bit of a gap or a little bit of space in between the back of your knee and the table or the surface that you're using. And all you want to do to perform a quadricep set or a quad set is you're going to squeeze all these muscles on the front part of your thigh. As you squeeze and tighten those muscles, you're going to want to think about trying to push your knee down into the surface. So as you think about pushing the knee down, you're going to notice that it's going to work on straightening that knee out. Typically what I like to do is have people hold that for an isometric hold, we call it, and maybe 10 seconds is a good count, and then relax a little bit. And how I like to do it is do 10 repetitions, holding each one for up to 10 seconds, or a count of 10. But you can really do it however you feel comfortable. If you want to do a more prolonged hold and hold it a little bit longer, that's okay, and maybe do a few less repetitions. But usually that's the ballpark I like to work in. And then I encourage people to do this multiple times throughout the day, maybe 3 or 4 times throughout the day, doing a set of at least 10 repetitions. Because again, it's so important early on, especially those first days, that first week after surgery, to try to restore that extension, that knee straightening, as well as restoring that contraction and starting to build back that strength of the muscles of your quadriceps. So that's the quad set, a pretty straightforward exercise. And here's a little couple things that we can add on, or similar type exercises that you can do. So one thing you can do is when you're performing your quad set, squeezing the leg, trying to push down, you can actually use your hand to provide some overpressure or an extra force. So you can kind of, whichever works better, you can use either hand, but you're trying to push your thigh straight down and trying to increase that knee extension, that knee straightening motion. And enough to really kind of feel it. Again, we don't want to go super intense where we just aggravate everything and cause a setback, but unfortunately some pain and discomfort is going to come with the territory, especially after a knee replacement surgery. So you're going to push, squeeze, do the quadricep, and then give yourself an extra little overpressure by pushing just above the knee on the thigh. And then again, still trying to hold that maybe for a count of 10 or so. And then relax. Another thing that you can add on is if you have a strap like this, or if you have something similar, so if you have, for example, a belt, if you have a dog leash, a towel, or a pillow bed sheet that you can roll up, and then you're going to be in that same position, but now you're going to put that strap around the ball of your foot and give a very kind of gentle, medium intensity pull. And so what you're going to notice now is as you do that quadricep set, you squeeze and push down, you'll actually feel a stretch along your hamstring and along your calf muscles. And now as you're doing this quadricep set, it's going to give you a little bit more intensity, stretching those muscles, working on range of motion, working on contracting and squeezing those quadriceps, all 3 things at the same time. And then from here, an extra thing is if you're really coordinated, is you can also put that pressure. So now you're doing the quadricep set, squeezing and holding, you're pulling with the band, getting a good stretch, and then you're putting a little bit of that overpressure with your hand. So if you're really coordinated and can get all those things in conjunction, you can get a really pretty good intensity, pretty beneficial exercise. It's giving you flexibility, giving you a range of motion, and working on strengthening and contracting that quadricep muscle. Now another thing that's a little different than a quadricep set, so to speak, but has similar benefits and is especially good for working on that knee straightening and that knee extension, is what we call low load, long duration. And what that means basically is you're performing a stretch or a range of motion activity where you're putting a very low intensity load through the joint or whatever it may be, and you're just going to hold that for a prolonged time. So for example, we're in this position that we would be for the quadricep set with the leg up on the towel or whatever you're using. And I like to use an ankle weight. I have a 5-pound ankle weight. You can use a 10 or 12 pound if you have it. Or if you have something similar that you can lay on top of your leg, and just what you're going to do is you're in this position and you're just going to lay that weight or whatever you have right on top of your thigh. And then you're just going to basically relax and let gravity provide that force, provide that low load, that low pressure in a downward direction, and it's going to slowly start to work on that knee extension, that knee straightening range of motion. So that's a low load, and then we're holding it for a long duration. So maybe 5 minutes, 10 minutes, whatever you're able to tolerate. Hopefully as you progress with this, as you keep doing it, you're able to tolerate a little bit longer each time, or maybe a little bit more on your thigh muscle. And then if you're really good, what you can do is if you have some sort of moist heat or hot pack, you can actually put that on top of the thigh first, and then put the weight on top of that. So now you're getting a little warmth, a little heat that might make it a little more tolerable and a little bit more comfortable when you're doing this activity. So probably what I would say the most critical exercise in those early days after knee replacement surgery is that quadricep set. It's going to be really great for starting to activate and contract those weak and atrophied quadricep muscles. It's going to be really important for restoring that knee extension and that knee straightening early on after knee replacement surgery, which is going to set you up for a great outcome and a great recovery from your surgery. And as of course, I also showed you some ways that you can progress that to really get a good stretch and a good range of motion activity. Thank you very much for watching, everyone. As always, please, if you're catching this on YouTube, click that button below and subscribe so you can follow us. I try to post content on a regular basis, everything related to knee replacement surgery, from preparation and deciding if surgery is right for you, to the actual surgery and recovery afterwards, and multiple things on frequently asked questions and all sorts of different topics. Thank you very much for watching, everyone, and take care.